I had to pay $39.35 to hold my baby after he was born. You need to pay money to hold a baby?
The New York Times put together a fantastic video asking people from other countries how they feel about the American healthcare system and to share their own experiences from their own country. Now, I'm going to play this for you, but first I just want to show you that despite having a Democratic White House and Congress, still there is no meaningful change being pushed when it comes to healthcare. Biden's family's plan excludes Medicare expansion, drug price changes backed by Democrats. This is really just around the edges. And still, they're not even fixing the bare minimum when it comes to the American healthcare system. So I'll discuss more on that after this great video.
Oh my God!
Imagine you're in America. Which of these options would be best for you?
That's a lot to think about.
What is an OOP max?
I guess with what I got here, I would go with Plan D because the deductible is 0.
Okay, there's more.
Gold, HMO, PPO, HMO.
And what are copays? I don't get... That's like if you pay for Spotify Premium and Spotify still makes you pay every time you listen to a song.
It's too complicated.
I'm lost. I'm so lost.
Here in Japan, even if you lose a job, you would never lose your health insurance.
When you lose your job, that's when society should help you.
I've chosen a creative job and had the backing of a healthcare system. But if you don't have that, do you pick the safe job or do you pick the creative job?
Price per unit for insulin in 2018.
Germany, $11.
Canada's $12. Wow. It's like 8 times the price of insulin in Canada. I guess that explains why Americans come up to Canada to buy medication.
I'm sorry, hold on. So the FDA doesn't have any authority over the prices?
We have also privatized health insurance companies in Germany, but the prices are regulated by the government.
The government negotiates the prices and fixes that price for 2 years.
In Singapore, they regulate this stuff to keep the prices down and, avoid like this happening.
Right, so I'm looking at an American medical bill.
Why is it so expensive?
$428,000 for rooms and such empty spaces. What?
Much cheaper to go Hilton Hotel than this one.
Skin to skin after C-section is $39.
I had to pay $39.35 to hold my baby after he was born. You need to pay money to hold a baby?
My brother Jamie, who's in a lot of our videos, was pretty badly injured. He's going to lose a couple fingers. If you can give $1 or if you can give $5, every little bit will help him and his family.
That's heartbreaking.
GoFundMe should not be something that people have to resort to pay for their medical bills.
So in America, people spend more than twice as much as in Japan for healthcare.
If I paid twice the amount for a car, I would want the car to be twice as good.
So what's the life expectancy in the US?
Why is it less?
The US should be on top of both of those lists. Like, if you're charging your citizens that much money, then they better be living the longest lives. It doesn't make sense.
When Alec turned 26, he was no longer allowed on his mother's insurance plan. Instead, he decided to pay for his insulin over the counter at list price. But the pharmacist told him a month's supply would be $1,300. He left empty-handed. Alec's official cause of death was diabetic ketoacidosis.
A couple of years ago, I developed a heart condition, and I had to have my heart restarted 3 times. After the third time I had it restarted, the doctor suggested I get heart surgery.
When I was 13, I started to get sick and really, really sick. I was then very quickly admitted into hospital, where after 3 weeks I had treatment for a brain virus.
The cost of the operation, I think, is about $60,000. And then the next day, when I left the hospital and I got my bill, it was a bill for parking. It was about $30.
And was treated by royal doctors, had several MRIs, lumbar punctures, all for free.
So I was pretty happy that I lived in Canada and had universal health care.
I couldn't have survived if I was in America.
To know that I can get sick, I can get injured, but I will still be taken care of. That is freedom. This is not freedom.
And that, I think, is the greatest point. Freedom. Americans care so much about freedom. How is a private healthcare system freedom? How is going bankrupt over medical bills freedom? How is being stuck in a job that you don't enjoy but you have healthcare? How is that freedom? Freedom is having healthcare guaranteed to you. Freedom is never having to think about healthcare. That's the system that I live in. Now, it's not perfect. If I'm talking to, a Canadian audience, I have criticisms of our system. We don't cover dental care, for example, but this Bernie Sanders Medicare for All plan does cover dental care. It is comprehensive. How is it freedom to live in a system where you are constantly worrying about getting sick? The expressions on those faces is something I'm also familiar with. When I discuss this issue, American healthcare, with people in my life that are Canadians, they're blown away at how crazy the American healthcare system is. And I'm talking about people that are conservative and liberals, people that normally you would think, at least in America, wouldn't support a universal healthcare system. But because they're conservatives who grew up within a system that guarantees them healthcare, they also recognize how completely insane it is that healthcare is not guaranteed to Americans. There isn't a single party in Canada that supports getting rid of our healthcare system. That should tell you everything. Now, in terms of Joe Biden, who is, I guess, supposed to be, helping people, he talks about how he cares about people. Well, why does he not support a Medicare for All system? This is an article from 2019, but I think it still largely applies to today, as you're going to see why. Although health insurers and pharmaceutical industry are funding a variety of Democratic candidates, all of whom are now either attacking or backed away from their earlier support for Sanders' Medicare for All bill, the primary conduit for their campaign against the policy appears to be Biden. Health insurers were thrilled when Biden entered the race, seeing his campaign as a bulwark against Sanders' plan for Medicare for All. And an In These Times investigation from July found that Biden received the most money in the Democratic field from insurance and pharmaceutical employees, while Sanders received the least. He kicked off his campaign with a fundraiser hosted by a health insurance executive, and one of Biden's campaign aides is a former health care lobbyist. There you go. Joe Biden received the most money in the Democratic field from insurance and pharmaceutical employees, and of course he has people from the private healthcare industry on his team. Do not be fooled by Joe Biden's kind language. Yes, it's an improvement from Trump, but if the policy isn't there, then what does it matter? More here. Study commissioned by Sanders shows U.S. pays 2 to 4 times more for prescription drugs than other nations. I mean, this is an issue most of you are already aware of, but another study was done on this showing the differences there. And of course, the video that I showed also touched on that. And in terms of GoFundMe CEO, 1/3 of sites' donations are to cover medical costs. This is an epidemic. The idea of having to rely on crowdfunding so that you can live, how can anybody possibly defend this? But you have entire networks dedicated to taking massive dumps on Medicare for All. And I'm not just talking about Fox News. CNN, MSNBC almost never discuss the need to move to Medicare for All. And if they ever do discuss it, it's because there's a guest on the show. And even that is incredibly rare. And they'll push back on that person. If you believe in science, if you believe in data, if you believe in human rights, if you believe in life, you should support a Medicare for All system. And clearly, Joe Biden despite having the House, despite having the Senate, is not doing anything to even nibble around the edges in terms of improving the American healthcare system.